senior crisis look like in the city of Oakland if we were actually living out of that principle? If we were shaping our policies and our practices all across the city based on the notion that I am because we are. If we based it on the understanding that we need all of us in order to be a thriving, healthy community.
Thank you, Shonda. Thank you very much. Let's hear from time for Shonda. Thank you.
I want to reference the fact that the numbers you'll be looking at in this report are from 2011. They're an update from numbers that St. Mary's Center used in a report called Going Gray in the Golden State that was done in 2007. It seems like a research partnership with St. Mary's is a theme for today. And we will have updated numbers again this fall, including the demographic analysis of California elders and cost of living. So we hit the next slide, please. Thank you. All right, let's ask, what does it cost a senior elder renting to get by in Alameda County? If you have good eyes, you can read it from my turn.
Okay. I'm on the camera.
Give me a number. What does it cost?
So,
1,400 a month. Okay. Others? 900. Okay. So I think you're talking more about what California has set as SSI levels, or what some elders may be seeing in terms of Social Security. Let's hit that number. It's about $26,000 in Alameda County to provide the basics of safe housing, transportation, health care, and an allowance for miscellaneous, things like cable, right? This number is about 4,000 more in 2011 than it was in 2007, with increased costs across the board for rent, food, healthcare, and transportation. And is there anyone in this room working on a minimum wage campaign this year? Quick show of hands, anybody working on a minimum wage campaign? So that $26,000 is pretty comparable to the $13 an hour minimum wage to provide a basic standard of living. Now, I know we're talking about housing costs for Affordable Housing Week, and I know some of the conversation will be around protecting tenants and developing more affordable housing, but we also have to acknowledge that people pay for food, right? They have to pay for transit, they have to pay for AC transit and cable bills. Folks in this room are very aware of the different standards for measuring poverty. Am I correct? Folks familiar with the top green bar is the Alameda County Elder Index for 2011 at about $26,000. The middle gray bar is the California Supplemental Poverty Measure. People familiar with this? It's a separate measure that the Census Bureau has developed. It's different from the federal poverty guidelines. I bet there's someone in this room who can tell us how federal poverty guidelines were developed. There's a researcher named Molly Oshansky, and in the 1950s they took a food budget and determined that a food budget, a family should spend about a third of its income on food. So they took what food would cost and tripled it. And that's how we got federal poverty guidelines. And so today, for a senior in 2011, we're looking at federal poverty guidelines of between $10,000 and $11,000 a year, which you can see from the Elder Index is well under half of what it takes a senior to get by. So other measures of poverty have been created, including the Census Bureau's Supplemental Poverty Measure, which is an improvement, but not a full reflection of what it takes to make ends meet. So that's looking at the standards for measuring poverty. This slide shows you common income sources and what seniors are getting by on. The Elder Index, again, the big green bar of 26,000. Median Social Security payments in Alameda County in 2011, just over $12,000 a year. And the maximum supplemental security payment, SSI payment, in 2011, just under $10,000 a year. So seniors are making do with nowhere near enough money. And Insight is currently engaged in a partnership with the California Hunger Action Coalition, the California Alliance for Retired Americans, and the Refund CA Coalition to increase the state supplemental payment on SSI so that it goes above the federal poverty level. Because I've just shown you different measurements of poverty, and yet the state is funding SSI for the age blind and disabled at levels below the poverty guidelines. Here. Okay, well, the Kremlin's not to it. It's not displayed very well. But for housing and transportation costs, in Alameda County on about $2,800, a single senior living alone would expect to spend of that $2,800 in income about $1,100 on housing. And statewide, that housing cost is more like $864. And seniors are spending about 2/3 of their budgets on transit and housing. More than 1 million Californians living on less than $900 a month, over 50,000 here in Alameda County on SSI payments that were cut profoundly during the recession and can be restored by our state legislature. California cut SSI payments below the federal poverty level during the recession, and reinvestment in these elders would reinvest in our local communities and our economies to the tune of about $100 million a year in Alameda County. So we're calling on the governor and the legislature to step up and take a serious look at SSI and give the seniors what it takes to really make ends meet. And with that, I just want to reference two of our coalition partners who said that SSI grants are lower in 2014 than in 2007, and the restoration would lift 1 million Californians out of poverty. And then the California Alliance for Retired Americans who said that the programs that were cut save lives and allow seniors to live with dignity. And as I look around the room, I see a lot of people committed to lifting people out of poverty and helping folks to live with dignity. And thank you for the opportunity to be with you this morning, and look forward to working with everyone.
Thank you for that talk and for welcoming me here today. And I've spent most of my career studying homelessness. And you may ask, why does a doctor study homelessness? And it's because of the devastating effects of homelessness to health. And I like to say, just some background, the homeless population is aging. In 1990, about 11% of people who were homeless were age 50 and older. By 2003, it was 1/3. And now about half of all homeless adults are age 50 and older. Now, as I rapidly hit 50, you might ask, why are we calling 50 old? But the truth is that people who are homeless in their 50s have aging-related problems similar to that of adults who are 70 or 80 in the general community. And so I like to say, when you think of our homeless elders, if you see someone who's 52, in your mind, think of an 80-year-old sleeping on the street at night. So the purpose of our study is to understand who is homeless after 50, because we really didn't know. Were these individuals who had spent their entire adult lives homeless? Were these individuals who left the criminal justice system and were released from prison to find themselves homeless? Were these people who were newly homeless late in life? We wanted to know why they became homeless, how long they've been homeless, how they're coping as homeless. You could imagine not that well. To understand what health problems, including aging-related conditions they have, and how they use their healthcare systems, and ultimately to understand what measures might prevent or end homelessness. And so we are enrolling 350 homeless adults, age 50 and older, in Oakland. We follow them here. The whole study is taking place here at St. Mary's Center every 6 months for 3 years, and we're asking the questions that we've talked about here. This study is actually funded by the National Institutes of Health, and we have not only are we doing it in partnership with St. Mary's, but we have a wonderful community advisory board who's helped us every step of the way. So we have so far enrolled about 300 clinic, where you might only get people who went to clinic. My fabulous staff, who is in and around the audience, is recruiting at shelters, free and low-cost meal programs, homeless encampments, and recycling centers throughout Oakland. And we said all of our participants had to meet the Alameda County definition of homelessness to be enrolled. So just some snapshots of who the population is. 1/3 of the population, everybody has to be at least 50, but we found that 1/3 are 60 and older is predominantly African American. So almost 80% of our sample are African American and predominantly male. About 3/4 of the sample are male. Next. So this is, I think, one of our most important findings to date, which is that 40% of the older homeless adults we're meeting were never in their lives homeless before they were 50 or older. So this sort of overturns the notion that most of the older adults living with homelessness have spent their entire adult homeless. What we're finding is that most of our older homeless adults were housed, working, living in the community until something happened after the age of 50. Next slide. Where are homeless adults online? So again, I want you to envision sort of your 80-year-old grandma sleeping on the streets. And what we found is that over 1/3 of all of our participants have been unsheltered for more than 2/3 of the nights in the prior 6 months. So living on the streets, under bridges, on AC transit buses. Some of the women we met actually sleep on AC transit buses at night, but not sheltered for over 2/3 of the nights in the past 6 months. You can see that 18% were sheltered every night the last 6 months. Next. And many participants many participants report spending nights with family or friends in the past 6 months. So many of our participants live on the streets for many of the nights or in our shelters, but do have enough connections with family and friends that they are spending some nights with their family and friends in the past 6 months. So that 1/3 report having spent at least one night without paying, staying with either a child, a cousin, some family member, or friend. And a 5th report staying with family or friend but paying by the night, that their family says you can stay but you need to supply some money for our household. Next slide. 2/3 of our individuals have been homeless for a year or more. So even though 40% were never homeless until they were 50, most of our folks who we're picking up have been homeless for a year or more. We are meeting people who are newly homeless every day when we go out to recruit. We are definitely running into new faces we haven't seen before. But once people lose their housing after 50, or once they are after 50 and are still housed, it's very hard for them to re-enter housing. We asked people where they lived right before becoming homeless. And almost half, 46%, reported that they became homeless having left an apartment or house that they rented. So most people were living in the community in an apartment or house, something happened, and they became homeless. We asked people the reason why they left their last stable housing. And 1/4 reported that the main reason, and really the only reason why they left their last stable housing, was either they or someone who was helping to share the burden of their rent could no longer afford to pay rent. So about 16% said they could no longer pay their rent or mortgage, an additional 10% said they could pay their share, but the person who they were sharing their house with no longer could. The most common reasons for being no longer able to pay your rent was job loss or illness, with job loss being the #1 reason. That you can see our biggest category is people who are either pushed or kicked out for reasons other than inability to pay rent or mortgage. A lot of people reported being evicted, and we are still trying to understand exactly what caused the eviction, but eviction for non-payment of rent. Didn't get along with people, they were asked to leave, they were drinking or doing drugs, or commonly people who they were living with were drinking or doing drugs. So, as I've mentioned, older homeless adults have the health characteristics of those 20 or 30 years older than they are in the general community. So, in our study, 56% reported that their health is fair or poor. It's a little known secret that we doctors use is that if we ask you the one question of how you would report your health, and we say excellent, very good, good, fair, or poor, People who report their health as very poor, that is the single biggest predictor of needing to wind up in the hospital or dying in the next few years, and it sort of outperforms any other measure that we use. So that number is an astonishingly high number of 56%. 34% reported difficulty hearing. Over half had difficulty seeing, even with current glasses. Many had difficulties with their activities of daily living. So activities of daily living include bathing, dressing, transferring, toileting, and eating. And over a third have a limitation in ADL. We normally look at people who have a limitation in ADL as being high risk for needing a nursing home placement in the coming year. You can see that almost a third need an assistive device to walk. 50% reported urine leakage or incontinence, and the most common reason for that is that they couldn't get to a toilet because the toilet was too far away. Cognitive impairment is very common, but there is a large proportion without impairment. So a third of the people we interviewed, we did a whole bunch of neuropsych tests to see if they had early signs of dementia or later signs of dementia. A third of people showed that they were in the bottom 15% of cognition, meaning not that they weren't smart, but that they had signs of dementia. A third had severe deficits in executive function, which is your ability to sort of follow directions, make this phone call, go to this place, go to that place. You can see that 10% had no signs of dementia whatsoever and were doing very well, and most of the people were in the mid-range. Next slide. Many had difficulties in strength and balance, including difficulties with walking. A third of people reported following the fire 6 months. Many of those wound up in the emergency room for an injury related to their fall. Next slide. And mental health problems are common. Over half had symptoms of depression. Over a third had symptoms of severe depression. A third had signs of post-traumatic stress disorder. And 13% had attempted suicide at some point. A quarter had spent time in a psychiatric hospitalization. Substance use problems are common, and predominantly cocaine and alcohol are the biggest problems. You can see that while 3/4 had used cocaine in their lifetime, about a third have current problematic use of cocaine. Most are not using it currently. Participants have access to primary care, but very poor access to dental care. So 72% told us that they had a primary care clinic where they went to, and half could name either a nurse practitioner or a doctor or physician's assistant who is their primary care provider. But almost half had not seen a dentist in more than 5 years. Next slide. There are high rates of emergency department use and hospitalization. So almost half of our participants have been to the emergency department and not been admitted to the hospital in the prior 6 months. And almost a quarter had had 2 or more visits in the prior 6 months. 18% have been hospitalized for a physical health condition in the prior 6 months. And 5.5% have had a psychiatric hospitalization in the prior 6 months. So I've just run through a lot of data just to give you a snapshot of the population, but I just wanted to draw some conclusions. So the homeless population age 50 and older now makes up half of the homeless population. The individuals have health problems similar to those 20 or 30 years older. And contrary to popular beliefs that older homeless people have been homeless for their entire adulthood, 40% were never homeless before they were 50. The older homeless group is not monolithic, or though all are at high risk. And I think it's really important to remember that different individuals are going to require different solutions. But there are clearly many opportunities for prevention. Those who are housed and in the workforce prior to age 50 and then experience a crisis, which is often loss of a job, death of a family member or spouse, could likely be identified before homelessness started. While cognitive impairment and significant disabilities are common, they're not uniform, and we should work to identify the relatively large proportion of older homeless individuals who need lighter supports. What they need is eviction prevention, they need low-cost affordable housing, rent support, or they could perhaps benefit from efforts geared towards bolstering their relationships that they have with their family and try to figure out how we could reunify them. And finally, others with cognitive impairment, substance use, and mental health problems will need more support in order to remain housed. And services directed at older adults should recognize that aging happens earlier in poverty populations. There are a lot of services that aren't available until people are 55, 60, or 65. And what we're finding is a lot of people who at the age of 50 are no longer able to work very physically difficult jobs and experience signs associated with aging and need those supports. I think that is it. So I will thank you to my wonderful team members, and particularly the St.